Hi, everyone. I'm Dr. Lynn Wagner, and you are listening to Doc's Thoughts. So, this episode is a follow up to a previous episode I did on skincare. So, in that episode, I detailed out the skincare products I use on my face morning, night, and throughout the day, and on my body as well. And I mentioned that I would talk about some of the procedures I've had done. And again, patients ask me this all the time. And I think it's important for people to know about these procedures that are available and understand if this is something they want to do, that there are different levels of things you can do procedure wise to help your skin look more youthful and more healthy. And if you're someone who chooses not to do anything, that's beautiful as well. But, for me specifically, when I got into my mid 40s, I started to just notice more of the lines on my face. That's really what drew me to looking more into skincare and doing some types of procedures for my face. And I have I would say, community that I can ask questions and I could bring these things into my own office. And so it was very natural for me to start using some of these things. I'm also a very natural person. You can tell I don't wear a lot of makeup. I'm not super fancy. And so I didn't want to do anything that made me look artificial or that froze my face so I couldn't have all my facial expressions. And so I've been very natural and gentle with what I have done to my face. And I also want to make sure that anything I'm putting in my body is going to be healthy. So I do believe that there are endocrine disruptors. I don't want to alter my body too much with anything that's synthetic to a certain point, just to achieve a goal of how I look. And so I took that all into account. And this is kind of what I came up with based on my level of tolerance for different types of medical procedures. And all of these things we actually offer at Wagner Integrative Health now. It makes sense because it makes it easy for me. And I have patients ask about it all the time. So I'm just creating this video so I can share it with them when they ask this question and we've run out of time at the end of their appointment. So the first thing I started doing in my mid 40s was Botox. So Botox is the botulinum toxin actually injected into your facial muscles, and it actually acts as a muscle paralyzer. So it causes muscle paralysis. And so you've all seen people who have had too much Botox, or if they had Botox gone wrong, where their face is literally just frozen, they have no facial expressions, or maybe one eyebrow is higher than the other, or they get these really funky arched eyebrows. We've all seen it. So that's not the goal, obviously. If you go to a provider who knows what they're doing and they can do it lightly on you, just as much as you need, I think you can get really, really nice results. And so I started doing Botox, and I just get Botox for the lines here. We call these the 11s. For my forehead lines, if you look at any videos from me, maybe 7-8 years ago, I had pretty significant forehead lines because I move my face a lot. And then a little bit on the sides where you get those wrinkles when you squint your eyes. And so I get that done, and that's something you have to do repeatedly. So it doesn't last for life. It doesn't last for 6 months. It lasts for about 3 to 4 months, I would say. And I'm a really active person, so I burn through it a little bit faster. Plus, they do it very lightly on me. And so sometimes I actually need it every 2.5 months or so. It's very painless. The injector uses these tiny little insulin syringes, and they inject tiny amounts of the Botox in the areas of the muscle where they want paralysis. And facial muscles are very complicated. So that's why it's really important that you work with a provider who knows what they're doing, who knows facial anatomy, who has experience. You can get licensed to do Botox in about 4 hours. So there are people who, have pop-up shops doing Botox. Probably not the place you want to start. Those people will obviously get better as time goes on, but you probably won't want to go to them in the initial stages. The other thing I found with Botox is, you'll see all these deals and people who do it for really cheap amount of money. And again, those are people who are probably not as experienced. So I do think that Botox is something that you really want to be in the hands of someone who understands facial architecture, facial expressions, can work with you on your goals. And you can have a really nice experience. So I've been doing that for a few years now, and I absolutely love it. Have not had any complications or side effects from it. The second thing I did as I was going through this journey, and I'm calling them procedures, but nothing I have done has included a knife. But the second thing I did was called a skin pen. So the skin pen is known as microneedling. So this device literally makes micro cuts in your face. They're tiny, tiny, tiny. They numb up your face before they do it with a cream, so you don't feel it. And it basically does all of these micro cuts in your face or any other areas. You can also do it on your neck. There's other areas where you can do the skin pen. And in doing so, it stimulates your body's natural healing process. And I love that. Like, why wouldn't I want to stimulate my body's natural healing process? As you're stimulating your body's natural healing process, you get more skin turnover, you get more collagen production and more elastin production. And the results of that are better skin tone, more youthful skin. You can actually reduce scarring. So we have patients who have a lot of acne, pock marks from their childhood acne that they had, and it can actually kind of not make them go away completely, but really minimize them quite a bit. So it's really, really nice for acne scarring, and just kind of not erase those fine wrinkles that you have, but just minimize them. So it kind of helps get rid of those fine lines and wrinkles. A lot of us get it around our lips, around our eyes. So it helps minimize those. What I love about the Skin Pen is when you do it in combination with Botox, the Botox is that temporary burst you get every 2.5 to 3 months, whereas Skin Pen is something that lasts longer because you're actually stimulating your body's own natural healing process. So they work very, very synergistically. So that I loved as well. The next thing I did is something that was newer. So our injectors here brought it into the office about a year ago, and it's called Sculptra. So Sculptra is actually a filler, and I had not ever done filler, nor had I wanted to do filler like the traditional filler. But this is actually, it's called poly-L-lactic acid, and it's biocompatible, biodegradable. So while it is synthetic, so it is man-made, it is more natural and more in tune with like the natural processes of the body. So you're not actually putting something that's just going to sit there. It's gonna biodegrade and not stay in your face. What it does though, after they inject it, is it also increases collagen production. It increases volume in your face. So one of the things that happens as we get older is we lose that volume in our face. You get more sallow and the skin sags a little bit. So this is kind of a plumper. So underneath the skin, it acts to add volume to your face, but then it also can help with those fine line and wrinkles, skin tone and texture. It's actually FDA approved for that. And it was an interesting experience because Sculptra is not something that you do and then like a week later you're like, oh, my face looks totally different. Botox, you have 5 to 7 days and then you see the difference. Sculptra is gradual because collagen production is gradual. So it can take a while to build up the result that you're going to get. But then the beauty of that is it also lasts long. So the typical Sculptra treatment is done every 2 to 3 years because that's when its effects start to wear off. So you're doing this treatment, but then you have 2 to 3 years of benefits from it, which I found to be very, very attractive. So those 3 things, Botox, Skin Pen, and Sculptra, I have found to be really, really nice just for my facial architecture, youthfulness, texture, and all those things that we are worried about as we get older. And then the other things that I do, and I have not been as good about these, but I'm putting it on my schedule now more regularly, are facials. I was never a facial girl. In my other video, I talk about how I was raised by a mom who sold Mary Kay Cosmetics, and she had to fight with me to even use any of the products because I just didn't want to do anything. So facials are definitely very new to me, but we offer at Wagner Integrative Health 2 different types of facials. One of them is newer, but the first one is the hydrofacial, which most people have heard about. And the hydrofacial is actually a vacuum. So you get this machine and then there's a vacuum on it. It's a tiny little vacuum, but it is literally a vacuum. And what it does is it extracts. So it's going to take away dead skin cells. And then it does this deep cleaning where it gets into your pores. So you're getting some of that gunk out of your pores. You actually get to see what they call the gunkies after you have your procedure done. And you can see all that dead skin and stuff that they've sucked out of your pores and off your face. And then the last part of the hydrofacial is actually a booster which penetrates. So after you've taken off all the skin cells, open up the pores, you choose a booster that's appropriate for your skin condition and your concerns and what your desires are. And then that sits on your face and it can soak in better because you've created this surface that things can soak up better. So hydrofacial is awesome. The newer machine that we have at Wagner Integrative Health is called the Glow 2 facial. And that is different. And that's actually these things called oxypods, which they are put on the face and they create a very carbon dioxide rich environment, which then encourages more oxygenation at the skin surface. And again, with that, you also get cell turnover, you get protection from free radicals, and you get hydration of the skin. So I look at these 2 machines, and what we've done here is we've actually created a facial where they can use both machines. So you can still get that vacuuming and extraction and kind of like the sucking out of all the bad stuff, but then you also get that oxygenation and free radical protection. And the combination is really, really beautiful. So I personally do the combo of both quarterly. Every 6 to 8 weeks is ideal, but realistically with my schedule, I think quarterly is about what I'm going to stick with. And that's where I'm at for now. So there have been no knives. There have been no synthetic fillers or traditional fillers. And most of my skincare is just nice, healthy, great smelling products and some periodic procedures or treatments that I have to go to someone for. And sometimes they involve needles. But to me, it feels very minimal. And it has made me feel really, really good about the look of my skin, how my makeup feels when I apply it, and how I feel when I'm doing videos like this as well. So With that being said, that's all I have for you today. If you have any questions on any of these procedures or products, please call the clinic, email the clinic, put a message in the notes below, and we will get back to you as soon as we can. But I've been really, really happy with the results, and I would love to see you happy as well.